consequence of COVID-19 virus, where you find the lungs tend to be compromised a bit in the sense that they may have some scar tissue, they may have some issues as it relates to one's ability to breathe properly. So you find that your breathing tends to be a bit compromised, the breathing tends to be a bit labored. And as a result of that, you can actually end up with subsequent conditions, things like pneumonia, even tuberculosis, emphysema, those type of things. So what can an individual do to correct that situation? What do we at Batson and Associates do? Primarily, long COVID is a situation where, in most cases, the way pathogens behave, and COVID-19 behaves just the same, where that particular virus doesn't completely leave the body in its entirety, simply because pathogens have the ability to hide in different aspects of the body. They do it very well in tissue, and you find that persons with long COVID is almost as if it is the virus had never completely left the body, and there is some residue left in the lungs that, as I said, could cause some problems later on. So you would want to be mindful with a number of things. If you remain with a cough, a dry cough, it may not necessarily be a postnasal drip, but it can also be a consequence, as I said, of having COVID-19. So what can you do, and what do we at Batson and Associates do to address that? Well, firstly, from a dietary perspective, one of the things that individuals would want to do is try and remove dairy from the diet. So no sort of milk. Cheese should be limited because those things do compromise lung health. If you're a person who have issues with things like asthma, sinusitis, well, then you're at even greater risk, because it means you have additional issues where that is concerned. One of the things we do at Batson and Associates, we do something called magnetic resonance analysis. And one of the things that has the ability to do is to determine or check the health of your lungs. Now, you have things like your chest x-rays, the breathing test that they would normally have you do. But with the magnetic resonance analysis scan, what it does, it gives us a clear indication of how the lung is functioning. And based on those particular baselines, if you're much lower than that, we know, okay, that there are certain things that we would need to do to correct that particular situation. And that's one of the things that, individuals need to be mindful of. I could give you an example. There was this client that I had who unfortunately got COVID 5 times. And of course, you would understand in a situation like that, a lot of antibiotics were used. So they actually reached in a situation where they were now diagnosed with pneumonia, and then later on they were diagnosed with tuberculosis. So the point I'm trying to help persons to understand is that once your lungs have been compromised after COVID, and you must know, as I said, look for the signs. If you're having problems with labored breathing, you find you're not able to hold your breath as you used to before, because all healthy individuals are supposed to take a deep breath and be able to hold it for at least anywhere between 8 to 10 seconds. If for some reason you're getting problems with that, or as I said, you find you're breathing a bit labored, then you need to really focus and work on that. Because one of the things that we're realizing is that a lot of persons after COVID, they actually dying from things like pneumonia, tuberculosis, and that type of thing. So it's very important, especially if you have a history of any respiratory conditions. As I said, things like asthma, emphysema, pneumonia, sinusitis, those type of things, you need to pay very, very close attention to that. So let me just give you quickly those telephone numbers for the Shogunas office. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Shogunas. That telephone number is 222-8261. That's 222-8261. And for Debe's number is 223-7515. That's 223-7515. And that office is located on the corner of Ramsey Mooch Trace and the SS Erie Main Road in Debe. Over to you, Samantha.
And our hotline numbers, if you have a medical question that you would like answered by Dr. Batson, feel free to call us right now at 627-3223, 627-3223, or 625-2257, 625-2257. You can also send your medical question via WhatsApp to the number 306-1065, 306-1065. And we do have a a comment, a message that comes via WhatsApp. It says, "Good day, Dr. Batson. I had COVID-19 in December. Initially, I lost my sense of smell and taste. And now for the last few months, everything tastes and smells like something is burning. Can you help me with this?"
Yeah, definitely. The thing with that situation, as I said, viruses or pathogens have the tendency to hide themselves in tissues, and they do that very well. They can hide in tissues for, years, literally hundreds of years, if an individual would live that long. I mean, if you look, for example, at the polar ice caps, they realized when these ice caps melting, there was actually some studies they did recently where they found bacteria. And when they were actually able to trace the bacteria in terms of the age, it was literally millions of years old. So that's to tell you how long pathogens have the ability to remain in the body. So with that being said, it means that a lot of symptomology associated with COVID, so loss of sense, loss of smell, the issues with the lungs that I was discussing, those things could remain and linger for a number of years. In addressing that situation, what you would want, we could definitely help with that. You would want something that would actually address the immune aspect of the body from its foundation. So you're looking at things like your vitamin D3. That's going to help you in that situation. There's a product we carry at Batson and Associates called Silver with Mineral Formula. And I've discussed this product on numerous occasions, numerous programs, simply because it has the ability to bring back the immune system to a very high level. But the advantage with it is that it does not affect any tissue in the body, and it does not affect the probiotics in the intestines. Even though we have to use antibiotics at some point in time, one of the problems that the medical community all over the world is experiencing is the overuse of antibiotics. Because when you give people so much antibiotics, they end up getting bacteria or antibiotic resistant strains. And it makes it very difficult for those strains to go away. So sometimes you get things like Flagyl, you get amoxicillin, you get Augmentin. I mean, Augmentin is a serious antibiotic. But the thing is, after using those over a period of time, it does not, the pathogen becomes resistant, and it makes it more difficult for the body to actually get over that particular situation. So what you want to really do, even if you have to use antibiotic in the initial stage, subsequent to that, you want to ensure that you do the groundwork in terms of dealing with the immune system. And that's where things like your specific protocol from dietary aspect, from proper hydration, even exercise and supplementation protocol that we do at Batson and Associates to help you to get over that. So definitely we could help in that particular situation.
And we do have a caller. Hello and welcome.
Yeah, good day, to the doctor and the host. Okay, so I'm in the chest clinic for a trace of bronchitis.
Mm-hmm.
Right. I am on Symbicort and Ventolin.
Right.
And that. But I use a CDAP machine to breathe with the sleep.
Right.
Sleep apnea.
Mm-hmm.
But what my initial problem was is that you have two passes to breathe through.
Right.
It was there that one of my nostril was almost passage was almost
blocked up.
Closed. The bone, it very have limited space.
Right.
So I have a tremendous problem to breathe.
Mm-hmm.
And I was wondering that if you could help with that situation, because normally I ask someone, I said, do you know when you're breathing? Are you aware when you're breathing? They say, no, they breathe normal.
Right.
But I tell them I'm aware of every breath I take because I have difficulty in breathing.
Yeah, the breath is so labored. Okay. All right, so you could listen.
So I don't know if you could offer any advice, or I could visit you or something.
Okay, good, no problem. All right. So very quickly, well, the thing is that there are some people who have that situation, and that, of course, from the perspective of anatomy and physiology, in some cases, because if it is you have a natural narrowing of one of the airways, then in some cases, if it's really, really severe, then they would have to do some sort of surgical procedure. But I mean, apart from that, based on what it is you say that you're using in terms of the Symbicort and the Ventolin, is that is not only the passage that you have an issue with, because you're saying that they made some diagnosis with slight bronchitis. And that's the point I was making initially. When you look at a lot of the diagnosis for respiratory problems, even asthma, I have met people who told me that they have asthma, and when we did the bloods and whatnot, it wasn't asthma that they had. But the thing is, pathogens have the ability to affect the lungs very badly, in the sense that they stay there and they can create a lot of scar tissue and that type of thing. So when we correct in that situation, we're not only dealing with the nasal passage, where you have a physical impediment, on one side, but we also have to deal with the health of the lungs themselves. And that's where we could come in and now do certain things. As I said, even the silver or the mineral formula, there's a tea that we carry. I mean, I love tea. So I always try to have a lot of teas that would help persons. We actually carry a long tea. And there's actually an enzyme formula that I use for persons with things like sarcoidosis, when you're dealing with serious infections in the body. So in your particular case, those are some of the things that we're going to have to look at. And you would definitely see some improvement in that situation. Okay?
And a reminder that if you have a medical question that you would like answered by Dr. Batson, feel free to give us a call right now at 627-3223, 627-3223, or 625-2257. You can also send your questions via WhatsApp to the number 306-1065, 306-1065. And we do have a WhatsApp message that is reads, Dr. Batson, good afternoon. Is it safe to consume kombucha and kefir every day?
I would say it depends on what you're dealing with. If let's say you may have problems with a UTI, so urinary tract infection, because kombucha and those type of things, because of the probiotic aspect, and we know, of course, any probiotic would have the ability to improve one's immune system, would definitely help. Me personally, I normally would use like every other day. And that would be able to help in some aspects of improving one's health naturally and that type of thing. So if let's say you're dealing with maybe a UTI or some situation like that, you could do it every day for maybe 2 weeks. And then subsequent to that, you could do it maybe every other day or every 3 days. And so the point I'm making, in the first instance, you're looking at a therapeutic dose because you're treating something or you're using it to assist the treatment of a particular issue. Subsequent to that, now you have what would be known as your maintenance dose. So a maintenance dose is usually less. So in that case, it would be one, as I said, every other day or every 3 days. Okay.
And we do have another WhatsApp message. This person says, good day, Dr. Batson. I had COVID-19 last year. And since then, I have not regained my energy levels. Are there any vitamins that I can take?
Yeah, definitely. The thing is, a multivitamin would help you in that situation. Most of your multis would have your basic mineral profile, which would be things like selenium, chromium, manganese, magnesium. So one of those. I'm very brand specific in what I recommend. So there are specific brands that I would deal with. And that's just based on the years of experience and, my scope of knowledge, that type of thing. Your vitamin D3 is always a big help. I'm a big advocate of D3 supplementation years now. Your zinc is also good as well. You would hear people complain and tell you 50 milligrams of zinc is too much. I disagree. If you use 50 milligrams a day, that's going to help you as well. As regards to what we carry at Batson and Associates, the lungs tea, we have gotten some really good results with that. If I'm dealing with someone with serious scar tissue in the lungs, people who have serious lung infections, or lung damage. So let's say someone who's working, maybe a hairdresser or somebody who works in oil and gas, and they have inhaled certain types of substances over a period of time, that can cause severe damage to the lungs. It could even cause lung cancer. Those are things and situations that we have helped already. The hydration, very important. So ensure that you do your numbers where your water is concerned. So again, your body weight divided by 2 ounces. That's the amount of water you should be consuming, because hydration is optimal, especially to healthy lung function. What you need to be careful of is if you have things like COPD, which is a pulmonary situation that involves the lungs and the heart. Because the thing is, when your lungs go, the next organ to go, or that will go with it, is your heart. Those two organs work significantly together. I mean, they work together in that whole respiratory aspect, circulation, cardiovascular, that type of thing. So it's vitally important to maintain proper heart health, that you ensure that you focus and treat the lungs properly. So as I said, there are a lot of things that we carry, and you could always give us a call, and we could actually make the necessary protocols and recommendations for you.
There's a comment here in WhatsApp. The person is saying that they are unable to take zinc supplements because it makes them feel nauseous.
That's something that you always hear a lot of persons saying. Now, not because you take a particular vitamin or supplement and it makes you nauseous. Nauseous, means that it is not necessarily good for you. There is something known as healing crisis, and this is something I try to explain to a lot of persons. So I'll give you a quick example. There's a very popular omega on the market. I wouldn't call the name, of course. That product is a good product. And I know that personally because there are other omegas that we carry at Batson & Associates. As I said, I'm very brand specific. The point is, that is an anti-inflammatory. Now, there are persons who would have used omegas and they felt sick, they felt nauseous. So what we need to do is determine why you're being nauseous. And most of the time, it has to do with healing crisis. And healing crisis is when toxins try to leave the body faster than your body is able to accommodate it. So most of the time, when you look at persons like that, they either have a dehydration situation or they have a gastrointestinal situation. So it means that we may not just need to change the way that you take it. You may have to take it before your meal. You might have to take it during the meal. You might have to take it after the meal. You may have to take it on an empty stomach with 8 ounces of water, that type of thing. Because sometimes even food combinations could cause problems, because sometimes you might eat a meal that has, for example, rice and peas, which is something that people commonly do, but that's a bad combination. That creates a lot of gas in the body. So the possibility exists you may have taken the supplement with a bad food combination, and that actually causes you to be nauseous and not the supplement. So we'll have to do a little sort of trial and error to correct the situation. But definitely, that is something that could be corrected. Okay.
And if you have a question for Dr. Batson, feel free to give us a call at 627-3223 or 625-2257. We do have another WhatsApp message. Good afternoon, Dr. Batson. What can you use for an ankle injury besides rest and elevation?
Good question again. The thing is, when you're dealing with any type of injury, you always want to give the body the correct substances. So we're not really talking about supplementation here, water, you're doing your therapy, whatever the case may be, to help it heal faster than normal. Now, in integrative medicine, there are some things that we use called adaptogens. There are also some things that we use called free radical scavengers. And we carry those at Batson & Associates. What those do is actually help the body to heal faster than normal. So an individual who has that situation, that's something that you would want to avail yourself of. You'd want to get your vitamin C supplementation in. That's very important, because that actually helps the body with healing. So you're looking at least anything between, let's say, about 1,000 to 2,000 milligrams a day. And of course, you need to work on the musculoskeletal aspect of the body health-wise. There's a product we carry called Inflammation Formula, which is designed to reduce inflammation in the body. Remove inflammation in the body, but it also helps in the musculoskeletal aspect. So things like tendons, ligaments, because you want to ensure that that heals almost as the way it was before. It wouldn't heal the way it was before, obviously, but you want to ensure that you use specific things that's going to help the body to heal faster and as healthy as it can.
And a reminder that if you do have a medical question for Dr. Batson, call us right now at 627-3223 or 625-2257. You can also send your medical question via WhatsApp to the number 306-1065. Batson & Associates is an organization of trained health consultants and practitioners in Ayurvedic, Chinese, holistic, natural, and nutritional medicine. And we do have a WhatsApp message, and it says, "Good day, Dr. Batson. What can I use for night cramps?"
Night cramps. The thing is, if you're having night cramps, cramps usually are an indication of two things: either mineral deficiency, poor circulation. Again, at Batson Associates, there's a tea that we carry called circulation tea. Well, that's one of the most popular ones we have. We never have enough of that. So what it does, it helps with the toning of the blood vessels, especially in the legs. Now, the thing is, some people would have situations. You have two types of circulation. You have pulmonary circulation, which is above your heart. You have systemic circulation, which is below the heart. So a lot of people have poor systemic circulation for a number of reasons, whether maybe standing too long, crossing your legs, which is something people do and they don't know that is a dangerous thing. It actually affects your circulation. Sitting down for extended hours, that type of thing. So in that particular situation, as I said, I would recommend, again, proper hydration. Look at your water intake, your body weight divided by 2 ounces. Look at the circulation tea, and that's something you could just come in and pick up at Batson Associates or call for delivery. We also carry something known as balanced circulation, which I use with a lot of diabetics, especially when their feet begin to get dark and that type of thing. What that does, that works with cleansing and toning the blood vessels, which is very important in improving circulation. It could also be a situation like when people have what they call restless legs syndrome, which is usually, again, a combination of poor circulation and some aspect of neuropathy. Because keep in mind, once you have poor circulation, you end up with neuropathy, which is damage to the nerves as a result of poor circulation. And there's a product we carry as well called Nerve Restore. That's actually one of my favorites, simply because it's a product, if you have any problem sleeping, that product is going to fix your sleep. But it also deals with things that are anxiety, depression, and it's all natural. So you don't have any side effect, or it is not something that is going to get you addicted. And then you would have to deal with withdrawal symptoms and that type of thing. It's not something like that. So again, you could always call and get some information for that. Let me just give you quickly the telephone number for St. James. St. James' office is Red Edge Mall, Western Main Road, St. James. That telephone number is 220-8113. That's 220-8113. And the Tobago office, that's the Triangle Building in Scarborough, Tobago. That number is 226-4553. In fact, tomorrow, please God, I'm actually working in St. James, and that's one of our open clinic days. So we normally do open clinic days where we can facilitate walk-ins. So not only, so we have appointments, but we also have space for walk-ins as well. So that's something that you could also avail yourself of. That number again is 220-8113. Back to you, Samantha.
And we do have another WhatsApp message. It says, "Good day, Dr. Batson. I am a female in my 50s. Is biotin really good for thinning hair?"
Yes, it is. No, it is. The thing is, you can't use biotin alone. and that's something I personally know for myself. When you're dealing with hair, thinning hair, especially as a female, women, especially postmenopausal women, would have a number of issues that they deal with. Now, a lot of women do not understand, or a lot of persons in general do not understand, that women could go through menopause. I'll just give an example here. So let's say a female went through menopause at the age of 45 years. She would be of the opinion that everything is all right, she good, she passed that stage in her life. Postmenopausal situation, operative word post, which is after, subsequent to, means that anywhere in your life, until you die, you can have hormonal imbalance problems. And a lot of women don't understand that. So they would assume that, okay, I've gone through menopause 10 years ago, 15 years ago, 20 years ago. And they do not know that a lot of the symptomology that they're experiencing, example, depression, anxiety, insomnia, thinning hair, excess weight gain, or excessive weight loss, actually are a result of postmenopausal syndrome. So the possibility exists, just making an example, that if it is you have a situation where you find you're reaching a certain age as a woman and your hair just thinning, it falling, it means that you need to address the hormonal aspect of your body as well as the nutritional aspect. So in other words, biotin is good, but you may also need to look at the hormonal aspect as it relates to that. There's a product that we carry at Batson Associates. There's one called Female Balance. There's one called Women's Formula. And those were specifically formulated for that. where you address the endocrine system, which is the system that controls the hormones, which in turn will give you the hair growth that you're looking for. That is a serious, serious aspect where hair loss is even concerned. Even with women in order to get the results that you're looking for.
And we do have another WhatsApp. Any medication only uses CMOS and eats healthy.
Okay, good. Well, the CMOS is a big thing. I mean, I'm a big advocate of CMOS simply because CMOS has like about 96 different minerals. Your body have something like 106 or something like that. So the ingredient profile is awesome. Those are things that we call nutrient dense. So there's a high levels of nutrients in it, chromium, zinc, selenium, that type of thing. Selenium, in fact, has been shown to give persons, most persons who get cancer, when they really investigate and they look, they realize that they have serious deficiency in selenium. So the CMOS is good. There's something that we carry called thyroid formula. That is also a big help. We have helped a lot of persons with Hashimoto's thyroid, hypothyroidism, hyperthyroidism, and even thyroid nodules with that product. Greens would always be a friend in that particular aspect. So you're looking at, again, nutrient-dense greens, so plenty callaloo, plenty things like your spinach. You want to stay away from the cruciferous vegetables, so you don't really want broccoli and cauliflower and those type of things as yet, until you have the hormones properly balanced. So I don't know when last they did things like T3, T4, TSH, but those are things that you're going to have to monitor. So as I said, the thyroid formula and any of your nutrient-dense greens, things like wheatgrass, spirulina, those type of things would help in that situation.
Batson and Associates provide alternative, natural, and integrated services and programs for individuals who choose to address various health issues and ailments such as weight loss, diabetes, acid reflux, constipation, cardiovascular disease, arthritis, and much more. And if you do have a question that you would like answered by Dr. Batson live on air, feel free to call us right now at 627-3223 or 625-2257. And we do have a caller. Hello and welcome.
Oh, hi. Good afternoon, Samantha, Dr. Batson.
Hi, good afternoon.
One of your previous callers mentioned an ankle injury.
Right.
And you have mentioned quite a few things.
Mm-hmm.
Now, I'll be more specific with my ankle injury.
Mm-hmm.
It's actually fractured.
Right.
And what would you recommend, the same product, or is there something else that you probably would recommend?
Okay. Well, some of the exact recommendation would hold. However, when you're dealing with a fracture, the nutrient profile going to have to be a little higher. So it means you're looking at things like calcium. Now, one of the things that people have to understand with calcium, calcium supplementation is a tricky thing, in the sense that I always prefer nutrient-dense greens, which is where you get a higher amounts of calcium. Example, not only greens, because look, for example, beetroot. Beetroot is one of the highest sources of calcium. Sweet potato. You're looking at things like this thing as well, chia seeds, or what they call chai seeds, high amount of calcium. So you always try, when it comes to calcium specifically, because that is what you're going to need, because your bones are calcium, magnesium, and phosphorus in what form? In the form of calcium phosphate. So it means that with those nutrient-dense things that I just mentioned, sweet potato, beetroot, those type of things, it means the body is going to absorb the calcium better, and your time frame for healing is going to be significantly increased, because those are some of the things that they do, for example, in sports medicine, when they deal with persons who have gotten fractures, damages, different nerve damage, and that type of thing. So you could always contact me or contact us if it is overseas. The number that you use would be, of course, 868-314-9975. So that's 314-9975. You could always WhatsApp that number, and I could have the information sent to you, and you get the necessary that would be recommended for that situation.
And if you do have a medical question that you would like answered by Dr. Jason Batson, feel free to call us right now at 627-3223, 627-3223, or 625-2257, 625-2257. You can also send your medical query via WhatsApp to the number 306-1065, 306-1065. Dr. Batson?
Yes, let me say a pleasant good afternoon to our listeners, our viewers on Facebook. We are live on Facebook. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. Again, those telephone numbers that you can call, you can give us a call on 222-8261. That's 222-8261. For Debe, that's 223-7515. That's 223-7515. That office is located on the corner of Ramsey Trace and the SS Erin Main Road in Debe. St. James is 220-8113, and that's Red Edge Mall, Western Main Road, St. James. And Tobago is 226-4553. Keep in mind, we'll be in, well, I would personally be in St. James tomorrow, please God, and that is open clinic day. So if you need to afford yourself of a consultation, of an appointment, because I know we have some appointments backing up for like 4, 5, 6 months, you could avail yourself of that tomorrow, please God. That number for St. James, again, it's 220-8113. Back to you, Samantha.
We do have a WhatsApp message. The person is asking how they can lose the COVID-19 weight gain.
Oh, cool. That's a good question. I think half the country had that situation. I mean, the thing when you're looking at weight loss is always a touchy issue in the sense that weight loss for women always tends to be more difficult than men, and the reason for that is because of hormones, estrogen, progesterone, gonadotropin, that type of thing. So because of that, women, it tends to be a little more tricky, but it's not impossible. Intermittent fasting, I'm a huge advocate of intermittent fasting. I mean, if people only know what benefit you can do to your body by doing intermittent fasting. You can do research. After God is Google, after Google is YouTube. Try not to get analysis paralysis where you look at too much things and you get confused. And don't go the way where you try to be an internet doctor and try to diagnose yourself and do everything. So you have to try and find a little balance where that is concerned. But definitely intermittent fasting, looking at your meals, all your meals that you're consuming, try and have some sort of protein in the meal, because your objective in weight loss is always not necessarily BMI, because BMI doesn't correlate to everyone. What you really need to look at is the body composition, where you have more muscle as opposed to fat. Because you could have someone who is 6'4". Look at those basketball players, for example, 6'4", 275, 280 pounds. And the muscle mass is high. The fat composition is under 10%, and the visceral fat maybe even under 5%. So, but they will be out of the BMI, but that doesn't mean they're unhealthy. So those are some of the things that you can do. We also tailor specific diets for persons who want, looking at things for weight loss, lupus, kidney patients, that type of thing. We tailor diets for anyone. So that's something that you could also take advantage of and contact us, and we could always do it specifically for that particular individual.
Batson and Associates provide services such as live nutritional blood cell analysis testing, critical body function analysis testing, and foot spa detox. If you have a question for Dr. Batson, we have a few more minutes, so you can call us right here, right now at 627-3223, 627-3223, or 625-2257, 625-2257. We do have a caller. Hello and welcome.
Again, with the ankle, the fractured ankle.
Right.
Swelling. There's lots of swelling, and I understand that's going to be on for quite a while. You mentioned to the other caller some anti-inflammatories.
Mm-hmm.
I just wondered whether that might be another thing for me to consider, other than, the beetroot and the sweet potato and the other things you mentioned. And also, Dr. Batson, would you have another open day where I can come in and see what you have? I'm one for all things natural.
Okay, yeah, definitely. What you can do, the 314-9975 number, just send some information there where you have a contact that I could get back to you, and I will be able to, you know, facilitate you properly in terms of information and all that type of thing. Okay, so that would give me the opportunity to really deal with it in its entirety.
Do you think we can squeeze in one more, Dr. Batson?
Yeah, definitely.
All right. This one says via WhatsApp, good day. I am a diabetic and I usually get dark marks on my skin after scratching. What could I use to make these marks disappear?
You would want to use, again, hydration. Water is everything. So look at your water. Try and up that. At Batson Associates, we carry a premium alkaline water known as Alkagen. And that's something that we have available for the public. Apart from that, once you're diabetic, you always need to work on your circulation. So that is giving you an indication that your circulation is a bit compromised, especially circulation, again, below the heart, which is systemic circulation. As regards to what we carry at Batson Associates, the circulation tea, balanced circulation. There's also a liquid product that we have for persons with things like blocked arteries, that type of thing, which is known as Circulation Plus. Those will also give you some help as well. Your omegas also very, very important. Your omega-3, your 6, your 9, as regards to dealing with diabetes, because those tend to help with the nerve and prevent you from getting things like neuropathy and that type of thing. So very quickly, again, those telephone numbers, you can give us a call. The Shogunas number is 222-8261. Debe is 223-7515. St. James is 220-8113. And Tobago is 226-4553. My open clinic day in Shogunas is usually on a Wednesday, but that's not every Wednesday. You could just always call the office and they'll let you know. And again, you could avail yourself of that particular situation. Samantha, as usual, it's always a pleasure to be in your company at Batson Associates. As we always say, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Thank you so very much, and you enjoy the rest of your afternoon.
Thank you so much, Dr. Batson. And that was our special health segment featuring Dr. Jason Batson of Batson and Associates. You can visit them on the first floor, Money Talks Building, 182 Southern Main Road, Montrose. And you can call 222-8261 or WhatsApp them at 314-9975. That WhatsApp again is 314-9975. And keep listening. We're talking health every Thursday right here at Freedom 106.5 FM.
Yes, Facebook family. Oh, that was a good program. So you heard for yourself, open clinic day, St. James. That's Friday, please God. So you could utilize the number. That number for St. James is 220-8113. That's 220-8113. And just Shaki telling me something. Yes, sir.
3 questions to take.
Oh, we have 3 questions to take. Shaki told me I have 3 questions to take. Honeybee selling a big heart. Honeybee, how you doing? 5 times. What? What are 5 times for? Honeybee, you see the hiccup going, right? So I use the thread from the shirt.
Miss Ellis question.
Miss Ellis question, okay. What do you say to someone who thinks that if they go to the doctor for regular visits, that the doctor would always tell you what is wrong with you? By the way, this person is not keeping track of the things going on with their health. Memory loss, narcolepsy, hearing loss, as well as vision problems. No, they need to take care of themselves. I mean, the thing is, Ms. Ellis, that's a very good question. The thing is, Western culture is not proactive as we're supposed to. Eastern culture is very proactive. China, even India, in some areas, people from that part of the world. So the thing is, you always want to be proactive as opposed to being reactive. A lot of people are of the opinion if they go to the doctor. If you come to us, I will tell you what areas that you have good, because I don't think you can have everything bad, although some of you all might surprise me. But you'll always have things that look good, and there are things that need improving, but you can always better your best. So my thing is, you should always try your best and find out, whether you go to the doctor once a year, you go to the doctor every 2 years, but it doesn't make any sense that you leave things undone, because some people think it's better to not know than to know. I disagree. Anything wrong with me, I want to know. Because I don't want to go 2 years from now and go and do a test and they tell me it's because I have 5th-stage prostate cancer. What the hell? Why going to do that? That's something you could do. Where is root cancer? That's killing you. I don't want that. So, it's a matter of just being proactive. All right? Ms. Rachel Johnson is saying, hi, can you talk about collagen and the recommendations for its use, please? The thing with collagen, I'm a big advocate of collagen. In fact, actually, there's a bottle I have there. But when it came, I was going to use it. I can't use it. I actually had to put it away for a client. There's a very good collagen that we get at Batson Associates. I like it because it's a liquid collagen. Not another issue with powdered collagen, but I like liquid collagen. This one is a high quality. Compared to other collagens, it's a little more pricey. But collagen on the whole is going to be expensive because where they get collagen from, where they have to, the source material is very expensive. There's a protein that we carry as well, very, very good protein, but it's a protein with transfer factor. So if I'm dealing with someone with arthritis, someone who has serious nerve issues, the elderly, those are things that they're going to have to use. So that's something that you need to do it. Can you open the nerve restore if it's too big to swallow? Yes, you can open the nerve restore. What I suggest you do with the nerve restore, if you are opening it, is you can put it in the chlorophyll if you've got chlorophyll or Genesis, and you could actually put it in that and drink it. You could drink it, with your breakfast. Okay? So we have a lot to discuss. Pleasant good afternoon to Miss Pauline McKenna as well, Miss Jermaine Mitchell, Miss Jennifer Sargent, Miss Avalon London. Dr. Batson, we need an outlet in Syntax. Check me for the office. Miss London is a real estate agent. You're selling real estate. Don't worry. We will be where we need to be when we need to be. Don't worry. God is good. All right. So, as usual, it's always a pleasure to be in your company. Keep in mind, all these long COVID people, if you know you get the people COVID or you get COVID, let me careful how I'm saying that, please take care of your lungs. We have lungs tea. We have, I know the tropical lungs. I don't think we have any in stock again, but I can swear by that product. Excellent product. All right. You're diabetic. Somebody who have diabetes. You're dying. I don't understand how people with diabetes end up with 1 foot and 1 toe and no toe, and what it is all you're doing. What you're doing is what you're not doing. You can't see your foot. You see your foot getting black, and you ain't doing nothing. You just saying down there. That's either 1, stupidity, 2, you just don't care, or 3, you don't know. So if you don't know, I'm telling you now what you need to know. Come and see about yourself. See about yourself. Too much people dying from diabetes in this place. Too much. You blind, you get diabetes and you end up blind. How you end up blind? You was doing foolishness. It's either you doing foolishness or the doctor you're going by doing foolishness. You cannot have no diabetes for 19 years, and when you're done, you can't see, so you blind, your foot cut off, you're just waiting to death. What kind of life is that? What kind of life is that? That don't make no sense. Even if you had to buy circulation tea, total circulation tea, not coming up to $200. And you all know I don't call price. So what you do? You're just waiting to dead? And bowling thing expensive? I was telling somebody recently, you know how much for a triple bypass? Let me tell you something. And that's why I always end my program. If you think health is expensive, try sickness. You go in a nursing home. Go there. You ain't getting water until you swipe that card. And I am totally in agreement with the people because it's not running on fumes. Things cost money. Machines cost money. The people light bill, everything that I pay. So you can't just walk in there and get free. So it means it pays to take care of yourself. The old people have a saying, my great-grandmother, one of the best human beings that I have ever encountered, and I thank God every day for the life, for the information that this woman shared in my life. She always used to say, an ounce of prevention better than what? A pound of cure. An ounce in comparison to a pound. How much ounces make a pound? 16 ounces, right? So an ounce of prevention way better than a pound of cure. And that's what plenty of holidays do. You know you're getting chest pain. You're greedy. You're eating all the macaroni pie, all the cheese, all the butter, all the lard, all the oil, all the doubles, all the fried chicken. And your chest hurting you and you ain't going to do nothing. Then again, you have a proper heart attack in your waist. And you have to go in the nursing home. You need to swipe your card or your children and then need to sign. And until, watch me, it could be how much emergency inside a day. They're not touching you until that check clear, you know? So play stupid. Play stupid. Take care of yourself. If you can't come by Batson, you expect everybody to come by me, because to begin with, I cannot deal with all of you. That's why we have Miss Karishma Ramdan, Mr. Paul Green, Mr. Rene Bastamante, and others. You have a system in place. Come and take care of yourself. You know how much people come to us? They just buy circulation tea and they get better. Up to now, I never see the people yet. They buy water, 3 bottles of water. That ain't costing you no certain money. They buy tea. But you know what? They're way better than they was before. All the varicose veins gone. The cramping in the calves gone. The poor circulation gone. Tomorrow is open clinic day in St. James. If it is you think you need an appointment, if you need to see me, call 220-8113. That's 220-8113. I'm working tomorrow. I'm working from 12, by the way. All right? God bless you. As we always say at Batson & Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless you and your family. Enjoy the rest of your day. Take care. Till Sunday, please God.